Welcome to Feeding Our Young. Have you ever heard the phrase, nurses eat their young? Feeding Our Young is more than a podcast. It's a movement. It's a desire to see new nurses of all ages be supported and uplifted by their peers. And it starts with me. It starts with you. So join host Eric Miller, registered nurse of nearly 20 years and adjunct clinical instructor, and today's honored guest, me, Maddie Depner, and be ready to have your life uplifted so you can, in turn, uplift others. Welcome to the Feeding Our Young podcast.
Hello and welcome to a Saturday morning edition of Feeding Our Young. I say Saturday morning only because, we could be watching Saturday morning cartoons, but we're not. Instead, we are sitting with an incredible human being. And in preparation of this and knowing I would miss my Saturday morning cartoon time, my family and I watched some Looney Tunes last night. So, we make sure that you carve out time for the important things in your life, like Looney Tunes. Anyway, enough about that. Let's not waste any more time, and let's introduce today's honored guest, which is Maddie. Maddie, how are you this morning?
I'm having a great morning. I slept great last night. I did not watch any cartoons, though.
maybe that's why you slept great, instead of just one more.
Yeah, I'm not tortured by falling anvils and, wily coyotes,
Okay, so now, all right, now we're just gonna, I have to ask you this question because that made me think of something else. Okay. Have you seen the movie Who Framed Roger Rabbit?
I love the movie Who Framed Roger Rabbit. I love cartoons.
Yes, I knew it. I was like, I know we're kindred spirits. I know we are.
Yes, yes.
Although to say, for everyone else, it's going to sound like it's coming out of left field, but I unfortunately have zero theater experience other than being dramatic every day of my life. But Maddie, rumor has it you might be a theater child, a child of theater. You're not even a child, a theater kid. You know what I mean? Like,
yes.
Tell us a little bit more about that.
Yeah, I think a lot of people would say I have theater kid energy, and I don't really know how to take that anymore. I was in theater in high school, and I love the art, so I'm still a big time. I go to local stuff in Spokane all the time, so that's what I do.
I love it. And do you? Let's turn this into a nursing discussion. I feel that might be a good skill to have in the field of nursing.
Yeah, I think it set me up really well because it sort of forced me to be okay with like flying off the cuff a little bit. You know what I mean? Like to be with like flying by the seat of my pants. I feel like I'm really good at talking to patients because it's not hard for me to like improv what I'm gonna say next.
Yes. Yes.
Yeah, and also I feel like it's just nice because it kind of teaches you how to talk, like in a way that is like clear and, it's easy to talk to other people when it's not a performance, but it is kind of a performance, especially when you're delivering like, information about their medications or something, it's easy for me to slip back into that kind of like, oh, well, of course, this is your ondansetron. This is, you're so Fran, so, yeah.
Well, and I imagine it also allow you to interject a little bit of fun into your career. Do you see that being something that'll take place?
Yeah, I have a hard time not being a comedian when presented the opportunity. I feel like I'm always there for the bit, and I do think that a lot of that came from me being in theater and like everything. I have a flair for the dramatic also. I think that I love to be performative, I guess. You know what I mean?
Yeah.
A little bit of drama spices things up.
Yes, it does. Most certainly. I tell my wife that every day. So
Exactly.
for me, not because of her, because of me. But no. No, that's fantastic. And I thank you for just we're just gonna, like jumping right into our hobbies. So that's that. Let's pull this back around before I get too
Okay.
off the beaten path.
Yes.
What are 3 words, Maddie, that you would use to describe nursing school?
Okay, I wrote them down. My 3 words are challenge, growth, and fulfillment.
Ooh, challenge, growth, and fulfillment. Excited to hear why you picked those words at the end. But I'm kind of curious, from what perspective do you create these words? Are you already a nurse? Are you in nursing school? Have you been in nursing school?
I am in my last semester of nursing school right now. I have a month left and I'm graduating in May. So that is crazy.
1 month left. In the meantime,
I'm glad that you're interviewing me now as I'm about to graduate and not me 2 years ago when I had just started. Like I'm grateful for that.
okay, that's going to be a great jumping off point here shortly. So
Okay.
before we're going to sidetrack for a second because you're listener, you're probably not going to be able to hear it. But right now we've got a beautiful kitty in the background meowing and talking and trying to make herself known.
Yes.
So who is this beautiful cat and what's her name?
This is Selena.
Selena.
She's named after Catwoman.
Oh,
Selena Kyle.
Yeah.
And she's
Selena.
very needy.
Selena,
Yeah,
say something into the microphone. Selena. Oh, look at it. She is just content to have you just hold her there.
Yeah,
Oh
she's
my
needy.
gosh. Okay, so wait a second.
I think she heard me having a conversation and was like, I need to be included
She's like,
in
why are
this.
you not talking about me or to
Yeah.
me or anything like that?
Yes.
Very much
Yeah.
like a cat. So she's definitely not the first cat nor the first pet to make it on the podcast. And in fact, at the very end of every episode, if people listen that long past my wife's little, outro, what I call the outro, and she's given all the info on how to contact us and all the things. But and then you listen as the music fades, and the very last thing is kind of our unofficial mascot, Cleo. One of our cats was in the bedroom the very first time she recorded that outro, and she made this weird like meowing, and I'm like, no, I'm going to put that at the end of every episode. So she
It
is
has
at
to
the end of
be.
every episode. Well, Cleo, and now we have Selena. So. All right, enough. We've just rabbit trailed all over the place. I don't care. The other nice opening question I like to ask, just to get a kind of a glimpse into who you are. What are 3 of your favorite songs in life right now?
Okay, my 3 favorite songs. I picked a widespread here, okay?
Love it.
I Will by the Beatles, Slide by the Goo Goo Dolls, and then Juno by Sabrina Carpenter.
That runs the gamut. Oh my gosh, I love it.
Yeah.
I love it.
It's a big spread.
It is, and but it's important, right? And it just depends, kind of, I'd imagine, like on what mood you're in or what you're feeling in that moment.
Absolutely. I love music and I listen to a lot of it, and I was really struggling because I was like, I can't pick 3 songs that have the same vibe. I can't do that.
So I haven't picked my own 3. People are like, okay, I need to know what your 3 are. And so when I get that the Spotify, Feeding Our Young, music list, I'm gonna, the first 3 songs will be my first 3 songs. And I'm still,
Good.
I'm such an a-hole for asking this question to people because I'm like, I cannot narrow my list down to 3. And I'm like, so I'm still working on it. It's a work in progress. All right. Now, you've agreed to take the following exam amidst all your other exams, being almost done with nursing school. I
can't believe I've signed up for another one voluntarily, but here I am.
Maybe because this one's slightly more fun.
Yeah.
Okay, so the unofficial, patent pending, just kidding, Feeding Our Young personality quiz. I've warned Maddie about this. She's agreed to do it. But Maddie, you've not heard these questions yet, correct?
Correct.
All right. So let's find out what kind of person you are. Are you ready?
Okay, I'm ready.
Okay. And you can these can be rapid fire. You can give just an answer, or you can give rationale if you want. All right. Would you rather instantly learn a new language or instrument?
I would instantly learn a new instrument.
Are you team pie or team cake?
Team cake. I hate pie. Pie is so. This is a textural nightmare. I have to come forward with my truth about this. This is like, genuinely, I hate pie. It's awful. It's like the worst kind of dessert because it's just the crust is so good, but the filling is always texturally a nightmare. And then the filling touches the crust, and that's a textural nightmare too. It's bad. It's always bad.
Okay, so just when you're eating like a dinner plate, are your portions or whatever different food stuffs like not touching each other?
Yeah, I hate it when my food touches.
Oh my gosh.
I'm not a picky eater at all, but that is like my one, like, I want it to all be partitioned. You know what I mean?
Oh, I love this. I love
I'll eat
this.
anything, it just can't be touching anything else.
Maddie is very passionate about her pie and her food not touching. I love it. I love it. Well, okay. No, I'm going to ask a follow-up question, and this might have to be because I'm waiting until the very first, like, this very first segment airs, and when this very first segment airs, everyone I record with from that point forward will get different questions. So now you've just sparked in me the first of the next 5 questions.
Ooh.
So this will be a preview for anyone who's listening to Maddie's episode. So now what I want to know is when you eat your food, do you eat different stuff at a time and circle back around? Or do you have to finish one, like the vegetables first and then the potatoes second or whatever?
No, I can cross over. I'm happy to cross over. It's not one at a time. But it just has to all be separate. And I do like sauces.
No touching.
And I feel like sauces and condiments are like a weird like caveat to this because I enjoy dipping. It's just I want to be in charge of, or like
the mixture of the touching.
Exactly. Like, you know what I hate? I hate baked beans on a big dinner plate because the juice gets everywhere.
Yes, it does.
Yeah.
Yes, it does. No, yeah. I'm right with you. No touchy.
Yeah.
No touching.
No touching.
Okay, back to the actual unofficial personality test. We've already learned, I think, everything we needed to know. Really.
I was going to say, I feel like it's pretty easy to get a good sense of the kind of person I am just from that alone.
Oh my gosh, people have tuned out. There's some people are like, nope, I'm done. Nope, sorry.
Yeah.
Or there are others that are like, I really have to hear what she has to say because food isn't allowed to touch. Okay.
I'm the voice of the new generation.
Yes, you are, and of sanity. Anyway, would you rather have the ability to breathe underwater or fly?
I would rather be able to fly.
Okay. Is Wham's song titled Last Christmas actually a Christmas song?
Yes. And it's not only just a Christmas song, it's the best Christmas song. It's my favorite Christmas song. And covers of it are always good. Like, the original is good, but the covers are also good.
Okay, so you had me halfway through. This has been a great time together, Maddie. I hope you have a great rest of your morning. This was a wonderful time. I'll air whatever we did
I
up
think
to this
that
point.
Taylor Swift's cover of Wham's Last Christmas is good. And I'm happy to... I'll listen to all iterations of Last Christmas. I think it's all good.
But in the meantime, this is the downside to not having a video podcast. If anyone could have seen my face, because as soon as she said, it's the best Christmas song, I'm like, oh my gosh, like nobody's ever said that before in my life. It's fantastic. Okay, and the last question. You've been gifted a time machine. Are you going to go back in time or are you going to go see the future?
I'm going to go back in time. I feel like there's a reason that we can't see the future.
Oh, nice. Nice. And that's it. The results are in, Maddie, and you are amazing. Go figure. All right. That's it. That concludes the one silly segment we have as a consistent thing here in our Feeding Our Young podcast. So enough with the babbling and all the things, even though all of that was very important. Let's talk nursing, shall we? I think that's probably why people are here, so I might as well give them what they want. With that being said, let's lead off with what you said. I'm going to piggyback off what you said. And you're like, I'm really glad that you're talking to me now with 1 month left, as opposed to the me starting this adventure. You know what I mean?
Yeah.
Why? Why is it better to talk to the Maddie of now than the Maddie of then?
Oh, I'm just so much more adjusted to the chaos of being a nurse or being a nursing student.
Yeah.
I just, I feel like it's really, really hard. It's such a difficult transition from like normal prerequisite student to nursing student. And I did not handle it well. And I feel like I just wouldn't have had as much good insight because I would have been like, it's on fire, So I still definitely feel like my life is on fire sometimes, but I feel like I'm just way more equipped to handle it now.
Yeah.
It's always on fire. Okay. Yeah.
It's
Yeah.
like being a Washingtonian all my life. It's like when you're outside in the spring and it gets, the highs are like 60s, 70s. And then you hit
Hmm.
summer, at least here in Spokane, and man, you can get 90s, 100s. And at
Hmm.
first you're like, oh, this is miserable. And then as time goes on, you're like, okay, I'm getting kind of used to it. Maybe it's kind of
Yes.
like that. Yeah.
It's exactly like that. Yeah. I would say I've just adjusted to, I mean, I feel like even nursing is just a really chaotic profession and
Yeah.
there's just always a lot going on. And I think that like half the battle of nursing school is like learning how to adjust to and survive in that environment, or
Yeah.
like how to like become a player in an environment with that already has so many moving pieces.
Yeah.
So yeah.
So in summation, when you enter nursing school, you're always on fire. But at
Yes.
first you're screaming more, and then by the end you're like, "Oh, this fire's not so bad. I can
Yeah,
handle
fire's
this."
not so bad. Fire's cool. I actually kind of like the fire. It kind of brings a purpose out in me.
Well, okay, and on that subject then. So, you have some topics that you'd like to chat about, and I'm
Hmm.
very excited to kind of unpack those. And I'm trying to, I'm a reformed, learning my way podcast host, meaning I'm
Hmm.
trying not to be so formulaic. So I don't want to go through kind of my normal progression. So we're going to jump into one of those topics that you wanted
Okay,
to talk about, because I feel like that
sure.
lends itself to the subject of confidence.
Hmm.
You have a lot you want to share about that. So I'm going to stop flapping my gums. I'm going to shut my mouth and let you take over. What do you want to tell other nursing students and listening audience about confidence?
I just want to tell other nursing students that it is that I everybody feels like they don't know everything, you know?
Hmm.
I think that it can be really, really hard to go to clinical and sometimes it's just busy and it can be hard to feel like you're learning or being helpful or like like what you're supposed to do. And I just when you get to that point, I think it's so important to just ask because you have to know what you don't know in order to learn it, you know?
Yeah.
Um,
Yes.
I feel like it's really, really, really hard to. I just did my practicum for reference for all of this.
Yeah. Yeah.
I just finished up my practicum hours. I was actually on labor and delivery at the hospital that you work at,
Hmm.
on night shifts. And for those first couple of weeks, it was a an interesting perspective that I had never had before. Because when you're a practicum student, you kind of get more responsibilities than you do
Yeah.
when you're just like a normal clinical rotation since you're there 2 nights a week for like 2 months, so
Yeah.
the nurses there kind of get to know you a little bit and then they kind of want to help you on your way, I guess.
Hmm.
um but those first couple nights that I was there, it was a hard adjustment because I realized I was like, oh, I've never been an actual participant in something like this. I've always been an observer. And so it can be it can be hard finding or it can be hard to know to have confidence in what you do know. So
Gotcha.
for the first like birth that I saw for like at clinical for lack of a better word, I was surprised because one of the doctors asked me to help find the baby's heart rate on the monitor while
Hmm.
mom was pushing, and I was like, I don't know how to do that, even though I've done that before dozens of times. But I was
Yeah.
like, I don't know how to do. I've never, you know,
But I'm just the
I've d
nursing student. I'm just the nursing
yeah,
student.
I
Don't.
was
What
like,
are you
I'm a
doing?
nursing student. Nobody talks to me when things are happening. I
Yeah.
stand in the corner. Like this is my job. I don't leave here.
Yeah. Yeah.
Um, and that I think that honestly gave me, you know, because instead of being like, I don't know how to do that, I was like, I took a breath and I was like, I do know how to do that. And so I just started trying and then I found it and I was like, oh, that wasn't as hard as I thought it was going to be.
Wow.
And from that point, it gave me sort of a stepping stone to whenever big things started happening, whenever big nursing events started happening, I was like, oh, I can actually be a participant. I don't have to just stand there and
Hmm.
observe. I can actually do the things that I know how to do. I even got to start an IV on a precipitous delivery. Yes, it was very fast. The whole thing was very fast. She rolled in at like 6 or 7 centimeters of dilation
Whoa.
already, and she was very uncomfortable. And then it was like 15 minutes later, baby was out, and I got to start that IV, and it was so cool. But like I knew how to do that. And so even doing it under pressure, even though that was scary, it was something that I was like, yeah, I do know how to do this. I
Yep.
can be involved even in urgent situations,
Yeah. Yeah.
even though I'm not graduated, even though I don't know everything, I can have a part in this.
Nice.
So
And
yeah.
that is a confidence that is needed. Like, and
Yeah.
what you're saying, like, I mean, I take it to the next step.
Hmm.
Nursing students, including Maddie, like when you graduate, what do you become? Once you sit for the NCLEX and you pass the NCLEX, what do you become? The answer is
A registered
a
nurse.
registered nurse. And you are the one doing what you're doing. And
Yeah.
so you have to have that at least some level of confidence to be able to. Otherwise, you're going to be crippled. You can't do. You'll be. Your ability to take care of your patients will be just completely arrested. It'll be
Hmm.
crippled. It'll be stopped. It'll be, you know what I mean. So obviously, you have to reach that point at some point early in your career. So why not start earlier than that, right, Maddie? Like you're saying, like, hey, even in my practicum, here I am. I'm like, oh, I don't know how to do that, and then you have this moment where you're like, wait a second, I do know how to do this. I've done it before.
Hmm.
This is just a different situation.
Hmm.
It's like switching the brain from okay, I'm just in learning mode. I'm just quote unquote a nursing student.
Yes, at a certain point, you have to go from being in learning mode to being in practicing mode.
Yes.
And especially, and let's talk about starting IVs, because while I got so much experience starting IVs while I was on labor and delivery, even though I had literally never done it before, but I knew the theory because we talked about it. We had learned it in school. And so I watched my nurse do one, and
Mm-hmm.
then she let me do the next one and just stood over my shoulder and gave me advice basically and told me what to do. And then after that, I was like, oh, I understand, because I'd already learned the theory. I'd already done it once. Now it was just time to like put it into place. It's
Yes.
like, and then after that, I was like, you know, you have to start you have to start asserting yourself, especially in clinical. It's good to be assertive and to say, I do know how to do that and I would like to try again. Like I need the practice. So after that, all of the nurses, whenever they had IV starts, let me try. They would let me
Yes.
try it. And even if you mess up, it's okay. You have to keep trying. Like you have to keep practicing to get any better at anything. But I feel like it can be really hard, and it can sort of stymie your confidence a little bit if you
Yes.
don't do it perfect. You're
Yeah.
never going to do anything perfect. You have to do it anyway.
One
So,
hundred percent. Oh, you're preaching it. I can't agree with you anymore. Um, you have to have that level of confidence. You have to get to that point, and you will never, ever be perfect. That goes, ironically, circling all back around to the very first honored guest. Her episode was titled Perfectionist No More, and how nursing school like beats the perfectionist out of you, really, because you
it
can't.
really does.
Yeah, you can't be perfect. But I love that you brought up practicum and kind of to a lesser extent clinicals. So I know that was another thing you wanted to talk about. So talk to us about clinicals. Whatever it is you wanted to share. What is that? What was that like for you? Yeah.
Yeah, clinicals for me have been interesting. Have always been interesting. I I I'm at Eastern Washington University's nursing program, which is brand new.
Mm-hmm.
And I'm part of the first cohort through it, which
Yes.
is super cool. But it does mean that I I came onto the scene at a point where a lot of people didn't were like not ready to trust, because I guess I don't know, Gonzaga students and WSU students and SFCC students, well, they've been having clinical rotations at these sites for years now. And
Yeah.
so it can, and that curriculum has been there for years now. Like it always changes, but they have relationships with those schools already. So it was interesting for me coming from Eastern because I was not, coming from a different and very new program
Hmm.
that nurses maybe didn't trust as much or didn't have that relationship to yet,
Hmm.
you know? So, and I had a lot of interesting experiences with other clinical students where they would ask us, things about like their classes that we just hadn't gotten to yet because
Yeah.
our curriculum is different. It's set up differently. Like they're learning things in their first year that I wouldn't learn until this semester. They're learning things
Right.
about critical care in their second semester that I haven't learned until just now for my fourth semester. I'm about to graduate.
As
So
Eastern's been figuring out how to do
yeah,
this, right? Like
yes, exactly.
they're working their way through how do we make our nursing program and how do we, and so then yeah, there's constant changes, right? So
Yes, but the thing that was really important that my teachers have set up for us was they really wanted us to be able to participate in clinicals like no matter what. So we got a good dose of clinical knowledge at the beginning of every semester before we went, just so
nice.
that we would be able to participate and be able to give meds and know what meds we were giving and, regular cares that happen on the kinds of floors that we were going to be on and regular problems that we would run into. And, they gave us a good dose of all of that, uh, just to like help us out. But it can still feel like you don't have enough preparation. And it will probably continue to feel like you don't have enough preparation until you graduate. I took
Hmm.
my entire course load last semester was obstetrics and mom baby and labor and delivery, and I still got to the floor and I still was like I have no idea what is going on. um, but I am a firm believer that clinical is what you make of it, and that if
Yeah.
you want to have good experiences, you need to be able to ask for them and to put yourself into them. And you have to be willing to sort of humble yourself also and say, I don't know what to do, but I would like you to, talk to your preceptor and be like, I don't know what to do here, but I would love to know. I
Yeah.
would love to know what I'm supposed to do and how I'm supposed to do it.
Yeah.
In order to do that, you have to kind of ask.
Yeah.
You have to kind of be willing to assert yourself and put yourself in that, you know, into that position where you're allowed to do the things that you want to learn how to do.
Yeah.
Yeah, I just feel like I feel like you have to be sort of your own captain when you go to clinicals in a way. Like you have to be able to stand up for yourself and give yourself the experiences that you want. So,
Mm. Mm. I love that because and like what you said earlier, like there's that old cliche, right? You get out of it what you put into it. But that's basically what you're
mhm,
saying. You know what I
yeah,
mean? And I tell my students, like, don't be nursing student Eric. I've said it before, I'll say it again. Don't be nursing student Eric. Nursing student Eric was a timid little bunny and
hmm
sat in the corner and only did things when he was forced to. And
yes,
you know what
yeah,
I mean? And you have no better time in your learning career or in your future career to learn how to do something than to do it then under somebody else's license with somebody else's
yes.
experience backing
Take
you up.
Put somebody else's NG tube in. I know it's scary. Do it anyway. Like,
Yes.
please do it. It's good for
Yeah.
you. Because in 2 years, when you're on a med surge floor and you're expected to do it, of course, there are going to be people that are going to help you. But they're also going to expect you to have done it at least once before and not
Mm-hmm.
on a mannequin. They're going to be
Mm-hmm.
like, there are always going to be people that will help you. But it's good for you to come from a place of having already done it once before.
Yes. Yes.
I believe that wholeheartedly. I did
Wholeheartedly.
so many things on labor and delivery that I had never done before, and and I was just like, I don't even know what's going.
Yeah.
But it was good for me because the next time somebody said, "Oh, have you heard about this before? Do you know it?" I was able to be like, "Oh yeah, I've had experience with it. It's
Yeah.
been a while, but I've done it."
Yeah.
Yeah.
Well,
So,
and that's just it. Even if you know you're going into a clinical opportunity that is a field that you don't want to practice in, and
mhm,
maybe it's even confirmed for you while you're there. I always say keep an open mind. Maybe you like it. Who knows? But if you're like, oh no, I definitely know. Like me, ER. I knew, no, this is not for me. But while you're still there, advocate for yourself, like Maddie's saying, ask for those opportunities, and don't be afraid to step up to do some of those skills, even if you're like, I don't need that skill going to where I want to go. A, you don't necessarily know that's where you're headed. But B, and more importantly, the more times you do that, it builds a level of confidence, right, Maddie? I think that circles back around to what you were saying about talking to the Maddie of now as
Hmm.
opposed to the Maddie of 2 years ago, right?
Yeah. When I first started clinical, I was scared to do anything at all, which is funny because a lot of like we started our first semester was like geriatric care, and so we went to like nursing homes, which is again, it's like such low stakes for as far as like taking care of people goes.
Mm-hmm.
Like there's
Mm-hmm.
I mean, it is high stakes because like there's like pressure wounds to think about and like
Oh, yeah.
proper nutrition and like choking hazards and ADLs, all these things to think about. But it's not acute care. It's not acute
Yes.
care. It's like long-term care and it's different.
And
Um,
most of these patients are kind of at where they're going to be. It's not like you're trying to
yes,
prevent a
most
disease or
no,
treat a disease, you know what I mean, or something along
yeah,
those
at this
lines.
point you're mostly maintaining symptoms
Yeah.
and comfort and like making
Yeah.
sure that people can still live like fulfilling, you know, lives. Which is nice. Wasn't for me, but it was nice to learn about. But even then I was still scared to like be involved in like, you know, I don't know, uh like a change. You know what I mean? Like
Yeah.
changing the patient is something that I was still like, I don't know, this is my first time. If you've ever changed a baby before, you kind of know what you're doing. But you
Yeah.
know what I mean? It's like
Yeah.
even stuff that was low stakes like that, I was still so freaked out about and I was still like,
Yeah.
I don't know what I'm doing. I there just gets to you just have to trust yourself at a point that you're still learning and you're still practicing and that it's okay to not know exactly what you're doing the first time that you do it.
Yes.
As long as
Yes.
you're doing it, especially with supervision, and you should never be without supervision when you're a clinical student. So,
Right. Right.
yeah, it's great.
Oh, oh, I
It's such
love
a
it.
great way to learn.
It is. And I feel like there's another topic. This goes right hand in hand with another topic you wanted to talk about. And whether or not you've covered it all, let me know. But you also wanted to talk about how to thrive.
Yes, how to thrive at clinical. I think that thriving at clinical has a lot to do with internal reflection. I think that you can make your own I think that you can make your own clinical day good or bad based on how you think about it, right? Because
Mm.
even if you have a day where you feel unhelpful the whole day and you don't get to do any skills and you don't get to pass any meds and you feel like you're just standing around on the unit the whole day long, you probably still saw a lot of good nursing in action. You probably
Mm-hmm.
still saw a lot of good examples and like for example, I went to the Holy Family ER one time
Mm-hmm.
and I was hanging out there and this was still very early, very fresh in my nursing I don't want to say career because I'm not even graduated yet, but it was
Well,
still
yeah.
very early, I was still very fresh to nursing school and I didn't do anything all day long except follow my nurse around. I didn't start any IVs. I didn't pass any meds. I just kind of watched. And at the end of the day, I was debriefing with my mom, who's also a nurse, and I was like, I'm just so frustrated. I'm frustrated with myself. I feel like I didn't advocate for myself at all. I feel like I was too scared to do anything. I was, I felt so unsure of myself. And so like I didn't know what to do. And she just asked me, she was like, well, what did your nurse do? She was like, what did your nurse do all day long? And I thought about it and I was like, well, I watched my nurse admit people and give meds and
Mm-hmm.
use appropriate time management. And, I watched her prioritize like cares and when to give them and who to give them to and like
Mm-hmm.
what was important. And I watched her do an initial assessment on a patient who had respiratory issues, and I watched like how that immediately took precedence over everything else that we were doing because ABCs,
Mm-hmm.
and upon some reflection, I realized that I had seen my nurse putting into action this like entire clinical judgment, this entire skill of clinical judgment.
Yeah.
that we had been talking about at school and learning about. And I hadn't even realized it, but she was also making me do it with her. You know what I mean?
Yeah.
And so after thinking about that day, I realized that I had walked away with a lot of good knowledge, even if I felt like I didn't get to do anything. Sometimes it is also okay to just be an observer and to just watch
Yes.
things. You can do both, is what I'm saying. I believe that you have to advocate for yourself, but I believe that you also need to know when it's okay to just sit back and watch. ERs can be hard to be a nursing student in, especially a
Mm-hmm.
brand new nursing student.
Mm-hmm.
But even on days where you feel like you're not getting as much as you could be out of the day, it's up to you to find the silver lining,
Yeah.
to find the thing that you're going to take away from your day. I think that it's so important when you're at clinical to walk away with something that you're going to take away from your clinical day.
Mm-hmm.
And that day I took away useful clinical judgment and clinical reasoning.
Mm-hmm.
Even if I didn't get to do it myself, I still
Yeah.
got to see it happen. So
Yeah. Oh,
yeah.
I love that perspective because, I mean, how many times does a nursing student say, well, I didn't get to do a lot today? And so let me, for a brief second here, and this is not to call Maddie out. Hey, Maddie, as of today, how many episodes of the podcast Feeding Our Young have you personally listened to?
0.
0. And again, not calling her out, but the reason why I bring that up.
My good friend Jen was just on this podcast, and I don't even know if her episode is out. I haven't
No, it's
checked.
not out yet.
So...
No, and we talked about this before. I always ask that of my honored guests because I'm like, hey, you know what I mean? Then I know if they know, kind of how the flow goes or anything like that. And I'm like, but I always the running gag is I just needed to know whether or not I needed to judge you.
Yeah.
But no, just kidding. So kidding. But the reason why I brought that up is because you hit that point of reflection home. And anyone who heard that is like, oh, of course she says that. Eric says it all the time. No, she's not heard me say it once. So neener. No, but that's and I'm always almost to the point, like, I've become that instructor where, you know those instructors that have like that one thing that they hang their hat on. And they're like, you always, if you don't get anything else, get this from my clinicals and
Yes.
da-da-da-da. And they make it almost, they belabor it so much that you're like, yes, I've heard
Yes,
this
we
before.
get it.
Yeah.
If you get nothing else from my podcast episode, I want you to get that you should be thinking about your day. Like, I want you to get that you should be reflecting on what you're actually going to take away from your day at clinical. That is so important. It's going to be so important for continuing to be in school.
Yes.
I think that is even, I would go so far as to say that thinking about what you, like, reflecting on what you actually learned at clinical, even if you didn't do anything, is going to make you a better student. It's just,
and a better
that's
nurse.
what I think.
And a better nurse. Yes. I'm going to record you saying that. I'm going to put that on my phone so that now my future students, instead of having to hear me say it, every once in a while I'll just throw Maddie's voice out there. I'll see if I get somebody else's. We'll be like, boom. Just like, we'll
She's
hit it.
not graduated, not licensed.
And had no idea that I say that all the freaking time. No, and it is that important. Even if, like you said, that first moment for you was your mom. It was a mom-induced self-reflection, but your mom asked the all-important question, well, what did you do? You know what I mean? And then you were able to say, oh, well, actually, I did this, and she did this, and she did this, and I saw this, and I did this, and oh, I guess it wasn't a complete waste of a day. You know what I mean? Like, I'm over-summarizing, but
if
right?
if you really feel like you have no knowledge, if you really feel like there's nothing you can do, if you genuinely feel like there's nothing else that you can do in clinical, the best thing to do is shut up and watch your nurse and watch what they do and watch and try to think how they're thinking. That is, or even ask them. I've asked plenty of my preceptors, why did you decide to do that? What were you thinking in that moment?
Awesome.
Like, what did you decide to prioritize? Even just talking about that with your preceptor can be so valuable because it can teach you things that you didn't think of,
Yeah. What was the thought process behind your action there? Yeah.
Yeah.
I think that's why some nurses, honestly, don't like having nursing students or give that air of not liking having you. Because it's not some may take it as you're questioning, obviously you're doing this in a respectful manner. But some of them may take it as, oh my gosh, they're questioning why I did it the way I did it. And sometimes, if you don't have a self-confident nurse, then some nurses may look at that as like, well, I'm doing it the right way though. Like, why would they ask
Hmm.
me that? And that sort of thing. So
Yeah.
ignore all of that.
Hmm.
Their response to your questioning, if done respectfully, is not your burden to bear, if
Hmm.
that's a lack of a better term, right?
I think that that brings me to another great point, which is that you can't let having a nurse that doesn't really seem interested in teaching you
Mm-hmm.
ruin your whole day.
Yeah.
I did a rotation that was a really hard day for me because I had a
Mm.
nurse who, at the start of the day when she was assigned to me, uh, wanted nothing to do with me and basically told me as much.
Mm-hmm.
And I was not allowed to help with, I asked plenty of times if I could help with, help with like cares or like turning the patient or,
No.
and
No.
I was just not
No.
allowed. And
No.
then I was
No. Thank
told,
you. No.
yes.
Yeah.
And then I was told that it's because nurses are just very protective of their patients. And then I spent about 4 hours of my day in this patient's chart, and she had a very complicated medical history.
Yeah.
So that's still good experience, right? I was still
Yep.
like, you know what? I'm getting in the chart. I'm learning about how doctors talk. I'm still learning about like, how all these diagnoses are interacting. Like this is still good knowledge. And then I was like, okay, well, I've been reading for 4 hours, so I should take a break. So I told my nurse that I was going to go on lunch, and I realized that I had forgotten something at my desk, and I came back to grab it, and I overheard my nurse, talking to the RT about me, and she was calling me incompetent. And yeah, it was so crushing. It was so defeating. It was genuine.
Oh.
That's the worst experience I'd ever had at nursing school. And being the person that I am, I reacted very quickly and very emotionally and freaked out and ran away to the
Yeah.
cafeteria. And I was just like, I don't know if I can go back. I don't know what to do. Like, do I have to go back and talk to this nurse and confront her? Or like, because I think that being a nursing student can sort of give you that mentality where you're like, okay with being, like, you're okay with being told no all day,
Yeah.
which is, but that can also make it so that when you are told no all day long and it's maybe not appropriate, like
Yeah.
maybe you're really not being allowed to do anything, that you're sort of like, maybe I am the problem,
Right.
maybe I
Right.
am the problem right now.
Right.
That was a really hard day for me. Um, and I called my mom again because I love my
Mm-hmm.
mom so much.
Yeah.
Yeah, I love my
Shout
mom
out to
so
mom.
much. Shout out to my mom, the best
Mm-hmm.
nurse ever, the
Mm.
reason that I am involved in nursing,
Awesome.
truly. But she told me to talk to my faculty and to
Mm-hmm.
just be honest about what had been happening all day long and ask what he thought about it. And so I contacted my actual school faculty and told him what had happened, and I was just honest, and I was just like, I feel like I've been being put in a corner all day long and it's been
Yeah.
really really hard. And now I was like, I don't think that I can be with this nurse anymore because I
Yeah.
don't I was like, I'm not learning. I was like, I'm not going to be able to learn,
Yeah.
and I only have so many days here. And he ended up just walking me through the unit for the rest of the day and teaching me everything that he could about every individual patient. And it ended
Hmm.
up being an okay day that I got good experience out of. But that initial encounter was just
Yeah.
so defeating. And I was just
Yeah.
like, maybe I'm not even cut out for this. Like maybe she's right, and I'm not
Yeah.
competent enough to be here. Um, that can be really hard. And then later, after, doing some more clinical days and getting some more experiences, I realized that so much of I was taking my nurses, to be frank, bad attitude about
Mm-hmm.
having a student and
Mm-hmm.
making it my fault.
Yeah.
And you just can't do that. Some days there are going to be nurses that would rather have not have a student,
Yeah.
but we are all a community, and they have an obligation to teach you as much as you have an obligation to learn from them.
Yeah.
Like
Yeah.
owe that to each other because that's how they learned too.
Yep.
Like that's the thing they say I know that they tell preceptors to remember when they were students. Sometimes that's harder because it was a long time ago, but
Mm-hmm.
they learned the same way that you're learning. And so you can't let them having like a bad attitude about having a student, like you can't let that be your fault. You can't take that home with you.
Yeah. Yeah.
You have to leave that at the door too.
And I'm going to take that to springboard also to talk to my fellow nurses, especially having been in the business for long enough that, I was becoming a cantankerous bitty nurse and starting to go down that road ever so briefly enough to go, whoa, I don't want to be that. But to my fellow nurses, like you just heard right there, this is why I'm passionate about the Feeding Our Young movement, why I'm passionate about this podcast, why I'm passionate about nursing students, talking to nursing students, because yeah, okay, you had a bad day, whatever the case may be, you thought that the nursing student left, and you talk about them behind their back. Let's not even talk about the middle school behavior that represents. But, because there's no excuse for that. There's absolutely none. I don't
that's
care.
Workplace incivility. That's like,
but,
they make PowerPoints about this.
Very much so. But the thing I want to say about that, though, too, is that this is why so many, like, we need nurses. Ergo, we need nursing students. Ergo, we're all human. Ergo, add all those things together. This is nursing math. Nursing students have enough voices in their head doubting themselves, their own voice, other people's voices, whatever the case may be. We all do. Don't, fellow nurse, add your voice to that list. Yes. Don't be the one that they get to hear for the rest of their life going, you know what I mean? Please don't do that.
There was a very serious week after that where I was like, should I quit nursing school? And like, it sounds dramatic. We talked at the top of this episode how I have a flair for the dramatic.
Yeah.
But you have to understand that in the context of like, I already feel like I don't know anything. And then having that confirmed by an outside source who's already been a nurse for 25, 30 years.
Yep.
I should just go home. It's like, I should just go home.
It's a lot easier to flip burgers, that's for sure. You know what I mean? Or whatever. And no offense to anybody out there that flips burgers, but this piggybacks right into the last thing you wanted to make sure you talked about. And that was what makes a good nurse. What are you looking up to when you see a good nurse, Maddie? What is that you wanted to share?
I am really lucky because I have a lot of nurses in my personal life. My mom is a nurse. Her best friend is a nurse. Her best friend has been on this podcast. And I just, like, a lot of people in my family are nurses. A lot of the adults in my life when I was growing up were nurses or doctors. The thing that I have always looked up to in my mom was her determination. My mom is so resilient. My mom was a bartender for 19 years and then decided that she wanted to be a nurse. So she just went to school and became a nurse when I was like 12, which is crazy. That's crazy that she did that. But that's just the kind of lady that my mom is. And that really shows to me that any kind of person can be a nurse and a good one at that. Any kind of person, as long as they have that, like, you have to have that, like, fire in you a little bit. You have to be a resilient, like, fiery kind of person to be able to find a good place in this, in this career.
Yeah.
So I feel like good nurses are resilient. They don't let bad days be their downfall. They don't let, not knowing the right thing at the right time. We're all human. We're all going to make mistakes. And we're already dealing with some of the toughest, it's hard to be a nurse. It's hard to see patients. You are constantly dealing with people that are sick and you have to rectify that your own way. But if you have strong inner resilience, I feel like it's easy, not easy, but like, I feel like it's possible. You can get to a good place. I also feel like good nurses are very compassionate. I, for a long time, was scared that I wouldn't be a good nurse because I am too feely. I'm too emotional. My mom, love her to death, but when I was a little bit younger, when I was in high school and thinking maybe nursing, she was like, I feel like she's like, you have to get better about getting too attached
Yeah.
to your patients.
Yeah.
And I reflected on that for a long time. And then I had sort of come to my own conclusion about that, which is that I think that if you're going to avoid doing something hard where you have to take care of people like this, the way that you do, I feel like it's better to be compassionate and empathetic than it is to.
Yeah.
It's like, it's better to care about real people and their lives and the outcome of the cares that you're giving them than it is to not. I think
Yes.
that makes you genuinely, I think that makes you a better nurse than it
Yeah.
does a worse one.
Yeah.
I think it makes it harder, but I think
Mm-hmm.
it makes your practice better.
So
And I
good.
think that, yeah, I think that that's okay. Then also humility, I feel like is a very big, that's something that I really look up to when my preceptor at, uh, my most recent preceptor for my practicum was so great because she was also kind of a newer nurse, and she was very, very honest when she was like, she was like, I'm going to consult with the doctors, with the nurses. She was always very, very upfront with me when she was like, I'm not sure what to do here. And I think that that is so great. It's like, it's good to be honest about where you're coming from in nursing. And that requires a certain level of humility because you have to
Mm-hmm.
sort of be able to be like, oh, I'm not sure, I'm not sure. I don't know that. But it's always better to say you don't know and get a good answer than it is to think that do something wrong and create a bad outcome for
Yeah.
somebody. I I would 100% rather be with a nurse that's willing to say that she doesn't know something when she doesn't know it than a nurse who's going to pretend like she does.
Bingo.
And then, yeah. And
Yeah.
then, and then you have, I don't know, then you have a dead patient on your hands or something. You don't
Yeah.
want that.
Nope,
You
100%.
don't want that.
Like you said, worse outcomes. We're trying to avoid all that for sure.
Yes,
No, that's
exactly.
amazing. I love those qualities of what make a good nurse. That's fantastic, Maddie. I love the wisdom that you have brought today. I hate to shut the wisdom faucet off, but
No, it's okay.
so before we shut the wisdom faucet off, there's a little bit more to come out of it, and we'll circle back around to those 3 words. You just used 3 words to describe great nurses to look up to. So you gotta have a bonus 3 words. I love that. But what were the 3 words you used to describe nursing school, and why did you pick those?
I picked challenge, growth, and fulfillment, and I sort of put them in that order on purpose because this was my experience. This has been my experience with nursing school. Uh, it is a challenge, it's a change, because you go and you are presented with an entirely new way of thinking, and you have to rewire your brain to think that way, and it's hard. It's really challenging.
Mm-hmm.
And then you have growth because you have to take what you're learning and reflect on it and integrate it into yourself. And that, whatever you say about nursing school, you're going to walk out of that door a different person than you were when you came in.
Yeah.
And I am really fortunate. I love the person that I've become because of nursing school. I have grown so much more confident and assured in myself and, ready to walk into like an adult world, if you will. Like
Yeah.
I'm ready to join a career field now. And I would not have said that 2 years ago. And then fulfillment, because I think that for me specifically, nursing school has been the most fulfilling thing that I've ever done in my life. It has created a community for me in a way that I never would have expected from any other job. I have made so many friends. I have met so many people. I've
Mm-hmm.
seen so many interesting perspectives on life and taking care of other people and what we owe to each other and how to be a nurse and be a person outside of being a nurse and how to not talk about nursing all the time, even though I think it's amazing and I do want to talk about it all the time.
Mm-hmm.
You find that person, like that fulfillment is unlike anything else I've ever felt. I feel so lucky to be in nursing school and to be about to graduate and about to be a nurse. I have found a lot of fulfillment in learning and continuing to learn and then getting to put that into practice. I love it. It is
Yeah.
what fills my cup. So those were my three words. I picked challenge, growth, and fulfillment. And
Mm.
that's because I think that that's how nursing school should feel. I hope it feels as amazing for everybody else as it has for me.
Oh, you're like the perfect poster child for nursing school. Like, hey, come on in. Like you're like a walking,
This is,
living,
I
breathing
would
ad.
like to be very clear because I do have friends who are going to listen to this when it comes out and they're going to be like, so why did you lie? It's also so hard. It's also so hard, and I've wanted to cry and throw up and rip my own hair out multiple
Yes.
times.
Yes.
At the end of the day, this is how I really feel about nursing school. Yes,
Mm.
it's hard, and I think that we should do it anyway. It is so fulfilling, and it's so nice to be the person that your friends go to when they think they're dying. You know what I
Yes.
mean?
Yes. When
I love that.
when you've been in that other side of that, you know what I mean? Where you like,
Yes,
I've been the
yeah.
one dying and I needed to go to my mom. I needed to go to my friends.
Yes,
I needed to
yeah.
whatever. And
It's
that's,
so cool to be the person that people are like, I have this thing on my toe. Can you look at it? Like, I love that. Yes, like I will look at that thing on your toe and tell you if you have necrosis. You know what I mean?
oh. Well, there
So,
you are, everybody. So, Maddie's phone
yeah.
number is, I'm just kidding.
Yes.
Please
Yeah,
do not,
everybody text me.
do not text her pictures of your weird rash. Okay,
Yeah, please don't
everybody.
do that.
So last thing, and you might have already touched on it. You might have not. It might be something different or it might have been something you said. I feel like I know where you're going, but then again, I don't know anything. So then the question is, if you had one thing that you wanted someone to walk away from your episode with that stuck in their brain forever, what would that be?
I I have so many things that I want to say to nursing students. That's why this podcast, that's why this is already so long. Um, but I think that if you take nothing else away, I did already say this, but I think that if you take nothing else away, you should know that nursing school and clinical and really whatever in life is going to be whatever you put into it. If you can put into it your best foot, if you can put into it your open mind and your ability to learn and your capability to take the next step and willingness to be a part of a system, you will get good things out of it. I'm so, so lucky. I put my everything into nursing school and I have genuinely met some of the nicest people who were willing to help propel me in ways that I never thought that I like. Even just I went to a hiring fair the other day
Mm-hmm.
and I just met other nurses and we all like when you meet other nurses, other people who are interested in nursing, they all want to help you. They all want to help you and I think
Yeah.
it's so wonderful. It's such a welcoming community. So, yes, what I'm saying is put into it, like if you put into it good vibes and good effort and good intention and good energy, you're going to get nothing but good out of it. You're going to get a
Mm-hmm.
community. You're going to get, new knowledge, new skills. You're going to get fulfillment. And
Yeah.
so yeah, yes. Sorry, that was probably really long and rambly, but it's just what it is.
But no, and that's what it is. And your passion is evident. I look forward to like seeing what your career brings. Like you legit, and I've said this about one or two other people before, but like you make me want to be a nurse, and I'm already a nurse. So like, you know what I mean? I know if you're having that effect on me, by golly, like you guys, you've got this. You've got this. It is so
You have
fulfilling.
got this. And it's
Uh,
so fun. And
yeah.
it's so fun. It is also really hard and scary, but it's so fun. You have to, yeah.
Yes.
I think that you have to have a certain, if you like to meet challenges, then you will love nursing. If you like
Yes.
to butt heads with challenges, then you will really like nursing. So,
Maddie, thank you so much. Thank you so much for giving up of your time on what was this a wonderful Saturday morning. Much better spent than
yes,
watching cartoons, which is
agreed.
why this is why we watch cartoons in our off time when you have off time again. No, I mean, and legitimately, and I'll end saying this, you guys. Maddie is like there's a reason why she hadn't listened to an episode of the podcast because she's going through nursing school and trying to get everything done and doing it in excellence and all the things. And yet here you are, you just carved out over an hour of time with me, with the listening audience, to share your heart about nursing. And that heart is big and it is evident. And I can't thank you enough. I hope you have an amazing rest of your day.
Thank you. I am so glad that you had me. This was so much fun.
So we get to do it again, right? We're going to do it again a little bit down the road, as long as the podcast is
Yeah,
still
yeah,
doing
no,
it.
hit me up in like 3 years when I'm working on L&D at Sacred Heart, and I will totally do this again.
That's what I'm talking about. All right, you guys. This has been Maddie. Thank you, Maddie. Have an awesome day.
Yes, you too.
Here's what's happening on the next episode of Feeding Our Young.
Going to school at an older age is hard. You got to have, of course, most people at 40 years old usually has routines, and they're used to a routine every day, which is not a problem in nursing school because you have to have a routine. Mm-hmm. Everyone knows in nursing school, you have to keep a routine, and you have to get up those early mornings. And I drive 2 hours away twice, 4 days a week.
Oh,
yes.
That is dedication.
Yes, so it has really taught me a lot. It's discipline, it's a lot. But nursing school, what I love about it is the little bond that I have formed with many friends. The friends that I have formed in nursing school are just a different breed, because you have to have those friends in nursing school, because if you don't have them, it's going to be hard.
Did you like today's episode of Feeding Our Young? Let today's honored guest know by emailing us at thanks@feedingouryoung.org. Also, if you are a nursing student, nurse, or a nursing instructor and would like to be featured on a future episode, please email us a few details about yourself at the very special email address mystory@feedingouryoung.org. If you have a question you would like addressed in a future Q&A episode, please send it to q@feedingouryoung.org. For all other inquiries, please email us at info@feedingouryoung.org or text us at area code 509-ALL-THEM 509-255-8436. We're so excited to have you return to hear our next honored guest. Be sure to follow us on TikTok, Facebook, Instagram, and YouTube at Feeding Our Young LLC. Again, that's username Feeding Our Young LLC. Until next time, be encouraged and go find someone to encourage today.